Let's talk about the cardiac rhythm, atrial fibrillation. Atrial fibrillation is an irregularly irregular rhythm that has a pacemaker, not just one, but thousands of pacemakers in the atria. The atria are literally just quivering. When it happens in the ventricles, we call that ventricular fibrillation or VFib. AFib, that atrial quivering, doesn't really allow for a whole lot of atrial kick. It doesn't allow for the ventricles to fill up with extra blood coming from the atria. This is because the atria are depolarizing at a rate of 600 to 800 times per minute, where our normal rate of depolarization is 60 to 100 times per minute. That is far too fast to have good output from the atria. Luckily, the ventricles will still have a controlled rate, depending on what makes it past the atrioventricular node. So the AFib rhythm doesn't have any discernible P waves. You may see some atrial activity that looks almost like artifact, or you might not see anything at all. The distinguishing feature is the irregularity. The QRS duration will be usually narrow unless there's any aberrancy. However, the R to R interval is completely irregular. So you might have some short R to R intervals, some longer R to R intervals, and this might be more difficult to discern as the rate increases. So make sure you watch that numerical heart rate. So AFib is an irregularly irregular supraventricular rhythm, and it doesn't have a constant pacemaker. So those atria are just quivering, blood may become a little bit more stagnant, and this can create clots or thrombosis. That puts the patient at higher risk for things like a stroke or pulmonary embolus. So that is the high risk with atrial fibrillation. That, and then of course, runaway tachycardia is where we call it AFib with a rapid ventricular response. That might require some sort of medicinal treatment. Anybody with chronic atrial fibrillation will be on some sort of negative chronotrope medication. That is the EKG review for atrial fibrillation.